Low testosterone is one of the clearest warning signs that a man will die earlier than expected. That's what large, high quality studies show. So the fix seems obvious, right? Top it back up, and there's a whole industry to help with that: testosterone tablets, gels, injections. But here's the problem: putting the number back up has never been shown to help. In the biggest trials, the death rate doesn't change. Now, most men aren't taking it to live longer, they take it to feel better, more energy, more drive, a sharper mind. Maybe you're on it or thinking about it, but the best evidence says it barely moves any of that either. And what's worse, it's quietly distracting you from the thing that's actually threatening your health. For a lot of men, taking testosterone does more harm than good, because the level is low for a reason that almost no one thinks about or fixes, and it's not your age. This is a great topic, and in this video I'll show you what testosterone is, why levels drop, what that actually means for your health, and how you can fix it, both the number and the problem causing it. That will improve your health and longevity. Let's get into it. Testosterone is made and stored in the testicles, and this is controlled by the brain. Deep in the brain sits the hypothalamus. When it senses testosterone is low, it signals a second structure, the pituitary gland, roughly behind the bridge of your nose, to release a messenger hormone into the blood. Now, that messenger travels down to the testicles and tells them to make more testosterone. So the system can break down in two very different ways. Either the testicles themselves stop working, or the testicles are fine, but the brain stops sending the signal. Two very different problems, and that's important for this video. And testosterone isn't steady through life. It surges in puberty, peaks in your late teens and 20s, then slowly falls off. From your 40s, it drops by 1 to 2% a year, and that slow decline has always been written off as a normal part of getting older. But that is far from the full story, and that's where it gets interesting. Before we talk about the impact of aging, here's a curious fact. Men today have lower testosterone than men of the same age did a generation ago, and we don't yet know why. Is it diet, environment, microplastics, modern life? Still to be determined. But let's unpack what we do know. Multiple studies show that age does play a part in declining testosterone levels through life, but we've badly overstated by how much and badly understated the impact of other factors. And one thing in the body matters more than anything else: fat. A study of nearly 1,900 men found that adding 4 inches to your waistline raised the odds of low testosterone by 75%. And 10 years of aging, just 36%. Your waistline matters more than your age. Here's why. Fat tissue isn't just storage, it's active. It pumps out an enzyme that converts testosterone into estrogen, it drives inflammation and insulin resistance, and all of that tells the brain to stop sending the signal to the testicles to produce testosterone. In a large European study, the most common kind of low testosterone was this kind, driven by weight and poor health. So for most middle-aged men, it isn't a hormone running out with age. It's a signal that something underneath is going wrong, in particular too much fat in the body, which wreaks havoc. In 2024, researchers pulled a number of high-quality studies and concluded that men below a certain level of testosterone had a higher risk of dying from any cause. So a low level is a really strong warning sign. So will raising the number help? Well, in a separate good-quality large trial of men with low testosterone and heart disease, half were given placebo, half given testosterone, and the outcome: raising testosterone did not lower the death rate. And this makes sense. Low testosterone is simply a symptom of the body fat, the insulin resistance, the underlying illness. It is those things that are harming health and increasing risk of death. Giving testosterone is not fixing those underlying issues. The low testosterone is simply the warning light indicating the problem under the hood, which more often than not is neglected. So taking it doesn't affect your long-term health, but what about the reasons that most men do take it? Mood, drive, focus. Does it make men feel better? The best trials looked at what testosterone delivers in men with low levels. The real benefits: it improved sex drive and function moderately. It corrected some types of anemia. It increased bone density, but as you'll see shortly, there's a twist to that story. But the things men most want, more energy, better mood, sharper thinking, there's a small, genuine effect on mood and energy. The trials are clear, it beats placebo, but it's modest. And most of what men report feeling is that small, real effect amplified by expectation. For sharper thinking and focus, no clear benefit at all. Okay, so it isn't as effective as it would appear, but is it safe to take? Well, the same trial I mentioned before that showed it had no effect on long-term health found some interesting side effects. The men on testosterone had more cases of an irregular heart rhythm, atrial fibrillation, they had more blood clots on the lung, and the strangest one of all, men on testosterone had more fractures. Even though it increased bone density, they broke more bones, and we don't know why. Are the men more active, so more at risk of injury? Are the bones denser but weaker? All yet to be determined. Now, these all came from a single trial and need more studies to confirm, so I'm definitely not saying testosterone is poison. I'm simply saying it may not be as safe as people believe. But there are two things that are genuinely important and rarely discussed. Firstly, taking testosterone shuts down your own supply. When your brain detects the testosterone you take in the supplement, it thinks there is enough in the body and stops sending the signal to the testicles to create more. And the effect on fertility is dramatic. In studies, this drops sperm counts to zero or near zero in most men within a few months. In fact, testosterone has been trialed as a male contraceptive for exactly this reason. For most men, it's reversible. Sperm production restarts when they stop, but recovery isn't guaranteed, and it's slower in men who've used it longer or who are older. In some studies, a meaningful minority still hadn't fully recovered a year after stopping. And secondly, and I've said it before, but it is worth re-emphasizing, if you take it, you might feel the problem is dealt with, and the real threat, the fat, the metabolic disease, the issue that is actually going to hurt you, continues to be ignored. That is the main reason taking testosterone might do more harm than good. So what should you do? Well, don't treat it blindly. Don't buy supplements or order an online prescription off the back of how you feel. Testosterone will do nothing if your levels are already normal. So if you've got real symptoms, low drive, low mood, sexual problems, see your doctor and get a proper morning blood test. If it is low, your doctor will check there's no other specific cause, such as a pituitary problem, a response to certain medications, or a problem with the testicles themselves. There are times when testosterone treatment is a valid option, but for most middle-aged men, the cause won't be rare or mysterious. It'll be the metabolic one we've been talking about, the creeping waistline. And the solution is simple. Lose the extra weight. When men lose meaningful weight, their testosterone genuinely rises, and the more fat you lose, the bigger the rise. Even 5 to 10% body weight loss helps, and 10 to 15% is where the real rise kicks in. As the fat comes off, the brain signal switches back on and your own production climbs. And here's the best part. Losing the fat doesn't just raise the number, it lifts your mood, your energy and your drive, the very things you wanted to treat in the first place. Plus, you improve your health and longevity in so many other positive ways. This is another reason there's so much interest in the new weight loss drugs like Ozempic and Mounjaro. Early studies suggest that as men lose weight on them, testosterone climbs too, but it's simply the same mechanism. Lose the fat and the brain switches the signal back on. And what about other supposed fixes? A few, like ashwagandha, nudged the number a little in some trials, but the men didn't feel any better. No real gain in energy or sex drive, and many of those trials are small, short, and funded by the people selling the product. You're probably paying to move a number that doesn't change how you feel or fix the underlying issue. Focus on losing the weight. So here's the bottom line. Low testosterone is a good early warning sign that your health is heading in the wrong direction. Take it seriously and ask your doctor to rule out any rare causes. But for most men, it's a signal that you've gained a bit too much weight in the wrong places and will hopefully be a motivation to lose some weight and get healthy. That is what will actually help, not the supplements. If you want the approach I use to transform my health, including losing 21% of my body weight, there's a free guide, link in the pinned comment and description below. Plus, I have lots of videos like this on related topics, visceral fat, cardiometabolic health, and a whole lot more. Click the video in the top left now to access those, and click the circle with my face to subscribe so you don't miss any in the future. Thank you so much for watching. Until next time, take care.